My name is Teresa Pinn-Kirkland, and I'm a nurse. I oversee the post-discharge team at Houston Methodist. So it's a system-level team, and we respond to patients who have been discharged from all 7 of our Houston Methodist hospitals. So Artera was initially implemented on the physician organization side, and that was 6 years ago for pretty much what everybody else was doing, appointment reminders, scheduling, things like that. And in 2020, I'd say September of 2020, there was an opportunity for Houston Methodist to work on a co-development with the post-discharge platform. And that's how I got looped in. We were using a different one. It was like a robocall, essentially, and everybody knows the pain points of that. So there have been so many different use cases and a lot of things that we've co-developed over the years. So over the years, we've rolled out multiple use cases. I know that a lot of work has gone into pre-visit preps where patients can text in their ID or their insurance card in advance. There's lots of communication where if they have questions and clarifications before they even show up for the day of, they can ask, and patients really feel a nice sense of relief and confidence showing up for things that they would otherwise be pretty nervous about. I think one of the unexpected benefits is the ability to have interdisciplinary coordination. It really helps when multiple practices are on Artera. You can @mention across practices with enterprise users. It is a great way to have much more timely communication with patients and to be able to provide feedback to our providers and to the different teams. Previously, our participation rate was probably 48 to 52%. With Artera, we have seen about a 66% on average patient participation rate, so it's a lot higher. My team for post-discharge basically is like the safety net. If you were discharged from any of our hospitals from OBS or inpatient, you'll get an outreach. We're trying to ensure that you transition home safely, that if you have any questions or care gaps or concerns that will impact your ability to transition home safely and successfully, that we can intervene or answer questions for you. And so a lot of times they just need, reassurance that you're on the right road. It's 3 steps forward, 1, 2 steps back, you're good. And a lot of times that is our role. And so for my team, we on purpose have made it very conversational. It's very personable. We're trying to make sure they understand there is a live person behind there. Patients send in gifs and emojis. We text back emojis all the time. Patients really engage and appreciate knowing that it's a real person on the other side who's responding to them. Anecdotally, you know that there's an ability to do service recovery, that you address questions and you help patients know when they need to come back and when they don't. Courtney Bruce, who is the Associate Chief Experience Officer, and I knew that we could look at the data and really quantify the difference and the impact that it was making. We had lots of patient feedback that they were really appreciative. And honestly, we were even surprised by the results. Like anecdotally, it'll be an improvement. It was surprising to see that there was a 3 to 7 point difference at the individual level hospitals for some of the domains. And overall, as a system, there was an increase in 2.8% in the overall rating for the hospitals. Every domain that's related to post-discharge saw a significant improvement.